Broadcasting from the business capital of the world, this is the Podcast Business News Network. And we are back with our guest, Kevin Richardson. And I thought we had a special guest that just left the frame.
Well, she's right back.
Hi, Vestet.
This is Bastet.
Oh, beautiful. My goodness. Yeah. How beautiful is she?
She's a little Savannah.
Wow.
Her great-grandfather was an African serval.
Oh, my goodness. Is that legal?
It is.
Savannah,
it is. She's an F3,
wow.
Meaning she's the third generation.
Beautiful.
And she's pretty demanding.
I see. I have a regular domestic tabby named Cuddles, and he's the same. But yeah. Welcome to the show. Not to upstage you, but we introduced your cat. What about yourself, Kevin? Tell us a little bit about yourself. We're on a live Zoom as well as our podcast today. For those of you wondering, that was Kevin Richardson's cat making a debut.
Yay, Bastet. And she's making her second entrance. So, my name is Kevin Richardson, and I am currently a master hypnotist. I will become a hypnotherapist in just a few weeks. So I'm going to be graduating with my degree in hypnotherapy. And I'm looking forward to working with folks with a variety of issues.
Wow.
And hypnotherapy has been around for 2,000 years at least.
Wow.
And it works on at least 145 different issues, such as anxiety, fears, phobias, pain. Oh my gosh, pain is a huge one nowadays.
Which we'll focus on. I would love to focus on the chronic pain today, Kevin, but continue.
We are. I'd like to explain a little bit about pain.
Yeah.
I'm no doctor. I play one after dark, but I'm no doctor.
We all do. Google.
So in broad strokes, there are two different types of pain. There's the acute pain, and then there's the chronic pain. The acute pain is, you fall down, you scratch your knee, you fall down, you break a hip. There's a sudden onset to it.
Yeah.
There's some sort of trauma involved with that. And it involves damage to the tissue.
Wow.
And it's noticeable. You can see it. It's on x-rays. There's swelling, bruising. There's maybe even open wounds.
And
these are typically just very sudden onset. And as the damaged area heals, that pain goes away. So, however, there are instances where the pain continues on. And so at some point in time, it turns into chronic pain. Now, the literature and the research say about 6 months. If the pain is persisting after 6 months, then it's becoming chronic pain.
Chronic. Okay, so 6 months is the threshold.
6 months is the threshold. That's kind of the breaking point. And it becomes more complicated in trying to work with chronic pain patients because typically there's no identifiable issue. There's no reason for it. They can't find it. And so things like fibromyalgia, some of these types of pains, they're there, they're real, and they can be severe and debilitating, but they don't know why.
Yeah.
They don't understand it. And it becomes debilitating for patients. Now, last spring, I'm going to tell a little bit of a story.
Okay.
I worked with a patient. She had fibromyalgia. She had severe chronic pain. When I went in and saw her for the first time, she was in a fetal position in the bed, just in tears. The pain was so severe. Her husband had to take her to the bathroom. Her husband had to shower her. Her husband had to dress her. She couldn't get out of bed. And So as we began to explore the pain, we learned that some of the pain can be controlled on how we manage our thoughts.
Mm-hmm.
Now, this is kind of interesting because how can thoughts control pain?
Mm.
You agree?
She's like, yeah.
Yeah. Um, and what they found is that Dr. Jensen, Dr. Mark P. Jensen, has done tremendous amount of research. He's authored or been a part of the authorship of at least 645 research studies and articles. How we conceive in our brain the pain will either make it worse or better.
Or, wait, who's that?
Oh,
That looks like my Cuddles.
Yeah, that is Grayson.
Oh, hi, Grayson. I didn't know there was two. It just totally tripped me. I'm like,
There's more than two.
so you're like the crazy cat man. Well, I've known as I have a coffee cup that says the crazy cat lady. I've had over 120 cats my whole life. So,
oh my gosh. Yeah.
Not all at once. The most I've had was 8 at a time.
6 is the most for me.
Okay.
But Grayson
Beautiful.
is our newest kitty. And
Grayson.
he's a little over a year old and he's a rescue.
Oh.
He was in the high desert and he was going to become a coyote snack. So I rescued him.
Nice job, Dad.
Yeah, he's a lover.
Yeah,
Every night
are they indoor or are they outdoor or both?
They're all indoor only.
So are mine, but I do the litter and I only have one. I do it twice a day. I remember having so many. I had one room designated to them in their litter box and I had a hardwood floor, but to clean it every day was the only problem. It was a lot of poop and pee and litter. Yeah. I got these Gorilla Grip rugs in the room. Yeah. Those are the best, just telling you. I don't know how, I just don't like litter on my floor, but it happens. So the Gorilla Grips are the best.
It happens. It happens. We have a room designated for the litter boxes, and then we have litter boxes in each of our offices, and then we have one in the
You are a good daddy. It's a lot of work. Yeah, I'm sorry to interrupt with the cats, but I couldn't not notice. If you're listening to the podcast, Kevin Richardson, by the way, has cats in this live stream that we're also zooming. So if they think I'm crazy, they're listening like, what is this woman talking about? Well, I'm watching Kevin. We're doing the live Zoom as well, just to fill you all in on the radio side of things. Thank you.
Yeah, I'm just a little old cat lady.
You're adorable, and you're helping so many people, and with what you do. And now today, the chronic pain topic. So
chronic pain, and it's so elusive. And typically you just go to your primary doctor and they go, oh yeah, here's some pills, take some pills. But then as it turns into chronic pain, then they start bringing in other team members to work with you. And so they'll send you to the pain doctor. The pain doctor will give you some pain medication. Then they might send you to a psychologist, or they might send you to a psychiatrist. And it's like, why? Why are you doing it? Well, there's the mind-body syndrome.
Okay.
And the body follows the mind. The mind is extremely powerful. And it can develop pain for you. So the pain is generated in the brain.
Okay.
Okay. The signals from the body go up into the brain, and it goes to the clearinghouse in the brain at the base. Then that clearinghouse sends the pain signal to 3 separate areas of the brain, which I find fascinating.
Wow.
The first area says, oh, it's 5/10 pain on a pain scale. It gives you your intensity. The second area goes, oh my God, it's throbbing, it's stinging, it's burning, it's aching, it's tearing, or whatever it is. Then the third section goes, Oh my God. It is the worst pain I've ever felt, and it puts the
Mhm.
emotion to it. So we're probably wondering, how does hypnosis help that?
Yeah.
I mean, how can you help with that? It is so fascinating because when you go to the hypnotist, they ask you about your pain, they take a pain history, they ask you all sorts of questions, and you're kind of going, what is this about? It's trying to get to know you, and it's
Okay.
trying to get to know how your subconscious works, because it's the subconscious that's controlling the pain.
Okay.
It's the mind controlling the pain.
Mm-hmm.
The signal goes into the brain, and then as it goes into the different areas, it gets misinterpreted. The signal goes in, it gets garbled, and then the brain misinterprets the signal
Okay.
and turns it into pain, which I find fascinating because this is where hypnosis can help,
Mm-hmm.
because we can change your interpretation of the pain by changing how the brain interprets it.
Yeah.
So, how do we do that? Well,
Good question.
we teach deep relaxation.
Okay.
Okay, relaxation has been shown that it can help to relax the muscles, and when you relax the muscles, you reduce the pain.
Mm-hmm.
How is that? Well, when we are having severe pain, we stiffen our muscles when we hold our breath. Well, oxygen is not getting to the muscles, and it's the oxygen through the bloodstream that helps to provide the needed nourishment for the muscles. So if they are devoid of their nourishment, they get more tense, and they send the signal of, I'm not feeling very good, guys. I'm feeling kind of poorly here. Also, when you tense up, you constrict the blood flow.
Okay.
Okay. And then when you hold your breath, you're reducing the oxygen intake.
Mm-hmm.
So what we do is we teach folks how to relax, and we teach folks deep breathing techniques.
Mm-hmm.
And by breathing in deeply, you're increasing the oxygen levels in the bloodstream, but also when you take a deep breath, you relax naturally. Your muscles relax.
Okay.
I'm sure in your career you've talked with people that are like la, 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 and they're just talking, and it's like, chill out, friend. Take a deep breath.
Uh-huh. That's usually me sometimes. Sorry. Yeah. It is. Guilty. Guilty.
It's like you need to breathe. So when you're feeling really stressed or really anxious, you can help yourself by taking a deep breath. And that will help you to relax. It will also reduce the stress levels. Stress has been shown that it can increase pain levels.
Mm-hmm.
So what a hypnotist does is it teaches you deep relaxation techniques. And they teach you self-hypnosis. So back to this person I was working with. I worked with her for 9 sessions. In the first session, I just brought her lots of information about pain,
Mm-hmm.
educated her about her pain. And so she learned about what pain was. And she learned how the brain processed pain. So the more she learned, the more she was able to understand what was going on with her body. Well, after 9 sessions, for the last session, I went to her house. I was seeing her at her home, and she was in the kitchen singing,
Wow.
and she was cooking, and she was
Wow.
baking. She was doing laundry. Her grandson was graduating from college, and she was preparing the banquet for the celebration after the graduation ceremony. And she had baked me a little loaf of black walnut chocolate
Oh,
bread. And she gave it to me. And we said our goodbyes. On the way out, her husband was preparing the car, and I waved at him and said, goodbye, nice to have known you, nice to have worked with you. And he said, come here a minute. So with tears in his eyes, he said, thank you for giving me my wife back.
oh,
And she was back to a functional level. And what it took was understanding what was going on with her body and how her body was interpreting it and how she could control it. So a hypnotist or a hypnotherapist empowers you to control your pain.
okay.
Studies have shown that by going through hypnotherapy, you can reduce the medications that you take, and you can reduce the episodes of pain. The pain's not going to go away, but you
Okay.
change how you think
Think about it. Mm-hmm.
So it's no longer the debilitating cause of just sitting in the corner and rocking like a zombie. It enables you to realize that, yes, your body has pain. Yes, we're going to change and reframe it. And part of this is also learning how to talk to yourself about what
Okay.
you're feeling. And that kind of goes back to the mind-body interaction. The subconscious only thinks in the present. It doesn't think positive or negative. It just thinks. And if you say, I'm having pain today, the subconscious hears, oh, pain? Oh, you want pain? Here we go.
Yeah.
Crank it up, boys. She wants pain. Give her pain. Or, I'm feeling sad today.
And
then you become
it's
sad.
making that, yeah. You
Or you say,
are what
I
you
am
eat.
absolutely.
You are what you eat. It's like my mom used to be so negative, and she was always negative Nancy because that's all she was. She just was so.
It's self-perpetuating.
Mm-hmm.
And the way you break out of that cycle is to change how you think. And that's where a hypnotist comes in. And that's where we can help you, is change how you are perceiving the information that your brain is getting from the body.
Mm-hmm.
You can change that. There is the theory of the pain gate. And they theorize that if you can close the pain gate, you can stop the pain. And there's some validity to that. And so I'm asked all the time, are you accessing the pain gate? Well, sort of. Yeah, we are. But we're accessing it in the mind and not in the spinal cord. So we're going up into the mind. The brain is what sits in our head, but it's the mind is what controls us. And they're trying to figure out what the mind is, and they really don't have a good definition yet.
Okay.
It's kind of pervasive. It's just kind of elusive as to what the mind is. Same as consciousness.
Mm-hmm.
What is consciousness?
Yeah.
Well, we're conscious, so we have consciousness. Well, what is it?
Good question. Mm-hmm.
It's not really known yet. It's one of those.
Mm-hmm. Yeah.
from the Arsenio show hall.
Oh my God, I remember that. Yes.
He'd go,
Yes.
It's one of those moments.
Moments. Yep.
What is it?
Yep.
We're aware, but why are we aware? We're aware of the pain, but why are we aware of it? But we have control of it and how we control our thinking. So one of the biggest issues in managing chronic pain is controlling how you think about it and what you think about it and what you say about it. One of the things with this lady that I was talking about is I told her, I said, you got to take the word pain out of your vocabulary. It's got to go. She was like, but I said, we got to go. It's just got to go. You got to stop talking about it. You got to stop thinking about it. You got to think of something else. She was relating to me that one night she was trying to get back to the bed and the pain was just horrible. And she looked at her husband and her husband, now remember what Kevin said, you can't use the word pain.
You gotta
think of something else. She goes, well, it's not comfortable.
Okay. Good try.
And they started laughing.
Wow.
And they broke out in laughter. And she said that was the most healing experience that she ever had. Because when she started laughing, the pain disappeared.
Wow.
So the brain was diverted from thinking about the pain to thinking about something funny and thinking about something that was positive and joyous. The brain can only process one emotion at a time. You exchange the sadness for happiness, the sadness goes away, the happiness comes in. So controlling pain is the words that you use. Use comfort, peace, calm, relaxation, these type of words, and replace the word pain with comfort. And also, I encouraged her to watch funny videos. I encouraged her to watch comics that she liked. I encouraged her to read jokes and be able to tell a joke of the day. And so she and her husband set up where they each had to present a joke of the day.
Aww.
And so it brought them closer together. It also helped them support each other during this transition phase. And at the end of the transition phase, they had jokes of the day on the refrigerator. She was watching YouTube videos on funny things, whereas before she wouldn't watch anything. She would just lay in bed, turn the lights off, and just ruminate.
Wow.
So pain perpetuates pain. Comfort perpetuates comfort.
It's like a law of attraction.
Yes, law of attraction. Perfect.
I have it in layman's terms. I'm sorry. I'm no expert like you. So
so, people ask me, why are you so happy all the time? Because I am.
Yeah.
I am what I am. I have to be a role model for my folks.
Yeah.
And if I perpetuate sadness or I perpetuate negativity, hypnosis won't work. It does not work if you don't want it to work. It only works if you want it to work. And I have found that in order for me to help my folks, I have to be passionate. I have to be compassionate. And I have to be a good listener and a good understanding of people.
Yep.
So A well-trained hypnotherapist is a part of the medical team.
Yep, absolutely.
It is a vital member of the medical team, especially in chronic pain, and also in reducing the use of pain medication. And this has all been followed up and it's been substantiated in research.
Mm-hmm.
And there have been books written on it.
Yep. And this is going back how many years you said we've been using hypnosis for?
2,000 years, over 2,000 years.
So you learn something new every day.
So I encourage folks, if you have chronic pain, find a hypnotist, find a hypnotherapist, find someone who is a specialist in pain management. I am.
Clearly. Great.
In management. I look forward to helping folks.
Can you tell us how we can get in touch with you, Kevin?
Oh, yes, I can. Oh, and
I was going to say, I wish I had my coffee mug. I'll have to bring it next time.
yeah.
Crazy cat lady. I swear that's what it says. It's purple and white and it's got a chip in it, but I love it because it's an honor. Some people make fun of me. I'm like, I have lots of love in my heart for animals, especially cats though.
I love animals and I love cats.
Wow.
So
and on cue, just to wrap it up, like she just jumped up there, like she knows it's time to go.
She
So
knows
Danny
it's
wants to
time
say
to wrap
goodbye.
it up. Yeah, it's time to say goodbye, Besta.
Oh, let me see the face.
No,
Okay.
it's not. No, it's not. My name's Kevin Richardson. My website is kevinrichardsontherapy.com. My phone number is on Pacific time, 760-902-2274. Give me a call. I can help.
Yeah.
I'm here to help.
Thank
So
you.
give me a call.
Perfect. Well, thank you so much for your time. Always a pleasure having you with us, Kevin. Have a great day. And to all of our listeners out there, please stay tuned. More of the show is on the way. Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.